Okay, so we will discuss about the defecation reflexes. Okay, colonic mass movement. Colonic mass movement describes the intestine contraction that begins halfway along the transverse colon. Okay, colonic mass movement describes the uh, intestine contraction that begins halfway of the transverse colon and pushes the intestinal contents in the proximal colon towards the rectum. Okay, it occurs shortly after a meal due to due to distension of the stomach and the duodenum as part of the gastrocolic reflex. And if feces is present in the rectum, stimulate the urge to defecate. Okay, what is the colonic mass movement? So the colonic mass movement describes the intestine contraction that begins halfway along the transverse colon. Okay, and pushes the intestinal content into the proximal colon towards the rectum. Okay, it occurs shortly after a meal due to due to distension of the stomach and the duodenum as a part of gastrocolic reflex. And if feces is present in the rectum, uh, it stimulates the urge to defecate. Okay, it's called the colonic mass movement. Then defecation reflex. The internal and external anal sphincters usually keep the anal canal closed and are controlled both reflexly and voluntarily. The internal sphincter is made up of circular smooth muscle innervated by the autonomic fibers, and the more distal external sphincter is composed of the striated muscles innervated by the motor fiber from the pudendal nerve. Okay, the internal and external anal sphincter usually keep the anal canal closed and are controlled both reflexly and voluntarily. Okay, the internal sphincter, okay, is made up of circular smooth muscles innervated by the autonomic fibers, circular smooth muscle, and the more distal sphincter are innervated are striated muscle. Okay, the internal sphincter are circular smooth muscle and the distal external sphincter are the striated muscle and innervated by the motor fiber from the pudendal nerve. Okay, the internal were the autonomic fiber and innervated by the autonomic fiber, and the external is fiber from the pudendal nerve. Okay, now when the critical mass of the feces is forced into the rectum, the desire for defecation is experienced. Okay, the critical mass of feces is forced into the rectum. The desire of defecation is experienced. Distension of the rectum causes the firing of afferent cholinergic parasympathetic fibers, which are transmitted to spinal control centers, resulting in the contraction of the rectum. Okay, relaxation of the internal anal sphincter and initially contraction of the external anal sphincter. This initial contraction is soon followed by the reflex relaxation of the external sphincter, initiated by the increase in the peristaltic activity in the sigmoid colon and pressure in the rectum. Okay, distension of the rectum causes firing of afferent cholinergic parasympathetic fibers. Okay, which are transmitted to the spinal cord, spinal control centers, resulting in contraction of the rectum. Okay, distension will result in the contraction of the rectum and relaxation of the internal anal sphincter and initially contraction of the external anal sphincter. The initial contraction of the external anal sphincter will be followed by the relaxation, okay, of the external sphincter, initiated by the increase in the peristaltic activity in the sigmoid colon and the pressure in the rectum. Okay, this reflex relaxation of the external sphincter can be overridden by higher brain center activity, leading to voluntary control over the sphincter, okay, which can delay the expulsion of feces. Okay, this relaxation of the external sphincter can be overridden by the higher brain center, okay, leading to voluntary control over the sphincter, which can delay the expulsion of the feces. The prolonged distension of the rectum then leads to uh, reverse peristalsis, okay, which empties the rectum into the colon and removes the urge to defecate until the next mass movement and or more convenient time. Okay, if more mass movement will occur, or uh, the individual will get the convenient time, this will be occur. Okay, when a person decides to defecate, that's when the external sphincter is voluntarily relaxed, and increase in intra-abdominal pressure must be achieved to expel feces. Thus, breath the is taken in, and the glottis closes over the trachea. The respiratory muscle contract on the lung filled with air. The abdominal muscle contract, which increase both the intrathoracic and the intra-abdominal pressure. Okay, the pelvic floor muscle relax, which straightens the rectum, and feces can be expelled. Okay, so what occurred in this? The When the person is decide to defecate, the external sphincter is voluntarily relaxed. An increase in the intra-abdominal pressure must be achieved to expel the feces. Intra-abdominal pressure should be increased. So for that, what happens? So the breath is taken in, and glottis closes over the trachea. The respiratory muscle contract on lung filled with air. Okay, the first breath is taken, then the glottis over the trachea is closed, then the respiratory muscle are contract on lung filled with air, and the abdominal muscle contract, which increase both the intrathoracic and intra-abdominal pressure. The pelvic floor muscle are relaxed, which straighten the rectum, okay, and the feces can be expelled. Good. Then we will see the fat handling. So what occur in the fat handling? The dietary fat is chiefly composed of triglyceride. Okay, the dietary fat is chiefly composed of the triglyceride, esters of free fatty acid, and glycerol, which may be saturated or unsaturated. Okay, fat handling. So what occur in this? The dietary fat is chiefly composed of triglyceride. Dietary fat is composed of the triglyceride, ester of free fatty acid, and glycerol, which may be saturated or unsaturated. Ester of free fatty acid and the glycerol. It's the triglyceride. Okay, the free essential fatty acid are linoleic acid and alpha linoleic acid. The essential fatty acids are the linoleic acid and the alpha linoleic acid, which cannot be manufactured in the body. The body is efficient at manufacturing fat, triglycerides, sterols, and the phospholipids, and will lay down substances fat stored stores. Okay, dietary fat provide 37 kg, around 9 kilocalorie of the energy per gram. Fat are digested almost entirely in the small intestine and are only released from the stomach into the duodenum. Okay, at the rate at which they can be digested. Okay, from the stomach into the duodenum. Okay, entirely in the small intestine and are only released from the stomach into the duodenum at rate at which they can be digested. Okay, so what we have seen here, that the dietary fat is chiefly composed of the triglyceride. The essential fatty acid are linoleic acid and the alpha linoleic acid. बराबर છે? Okay, which cannot be manufactured in the body. Okay, the body is efficient at manufacturing fats and will lay down subcutaneous fat stored. Okay, manufacturing body is efficient to at manufacturing fat and will lay down subcutaneous fat stores. Okay, they will form the subcutaneous fat stores. Dietary fat provides 37 kilojoule or 9 kilocalorie of energy per gram. Okay, so fat are digested almost entirely into the small intestine and are only released from the stomach into the duodenum at the rate at which they can be digested. Okay, in the small amount, from the stomach to the duodenum, the fat is released. Okay, so we will see the fat digestion. So, lingual and gastric lipase, lingual lipase and the gastric lipase begins the hydrolysis of the triglyceride. Although this is not physiologically significant unless pancreatic lipase is deficient. Okay, in the duodenum, fat is emulsified by the bile acid, a process where larger lipid droplet are broken down into the much smaller droplet, providing a greater surface area for enzymatic digestion. Pancreatic lipase digests triglycerides into the monoglyceride and free fatty acids. Okay, pancreatic lipase will digest the triglyceride into monoglyceride and the free fatty acid. These breakdown products form tiny particles with the bile acid called the micelles. Okay, these tiny particles will form the with the bile acid will form the micelles. These micelles are arranged so that hydrophilic hydrophobic lipid molecules lie in the center. Okay, surrounded by the bile acid, arranged such the outer region hydrophilic. Okay, so in the micelles are arranged like the hydrophobic lipid molecules in the center. Okay, and the hydrophobic bile acids uh, in the outside. Okay, this arrangement allows the micelles to enter the aqueous layer surrounding the microvilli. Okay, these micelles will enter into the aqueous layer surrounding the microvilli, and the products of fat digestion, fatty acids and the monoglyceride, cholesterol and the fat soluble vitamins can then diffuse passively into the electrolytes, leaving the bile salts within the lumen of the gut, where they are reabsorbed from the ileum or excreted into the feces. Okay, so this arrangement of the micelle will allow to enter it into the aqueous layer surrounding the microvilli, and the products of fat digestion, uh, cholesterol and the fat soluble vitamins can then diffuse passively into the enterocytes. Okay, leaving the bile salts within the lumen, and further it will be maybe reabsorbed from the ileum or will excreted into the feces. Okay, what is fat absorption? So once inside the Okay, so what is this? This is the lipid, this is the hydrophobic site, and this is the hydrophilic site. Okay, so fat absorption. Once inside the epithelial cells, lipid is taken into the smooth endoplasmic reticulum, where much of it is re-esterified. Okay, dietary and synthesized lipid are then incorporated into the chylomicrons in the Golgi body, which are exocytosed from the basolateral membrane to enter the lacteals. Okay, some small chain fatty acid may be absorbed directly into the blood. So what we have seen here, that the fat absorption, in the fat absorption, once inside the epithelial cell, lipid is taken into the smooth endoplasmic reticulum inside the epithelial cells, where much of it is re-esterified. Dietary and synthesized lipid are then incorporated into the chylomicrons in the Golgi body, which are exocytosed from the basolateral membrane to enter the lacteals. Some small chain fatty acid may be absorbed directly into the blood. Okay, then chylomicrons from lacteals. Okay, as we have seen here, basolateral membrane to enter the lacteals. Okay, okay. From here, Golgi apparatus will fo- form the lacteals, chylomicrons. From lacteals, chylomicron pass into the lymphatic system and eventually reach the bloodstream via the thoracic duct. Okay, will enter the bloodstream via the thoracic duct. Chylomicron consists mainly of the triglyceride with small amount of the cholesterol and the cholesterol ester in the center, with a phospholipid coat studded with the apolipoprotein. Okay, so this is the chylomicron. Okay, in which this is the protein, this is the phospholipid, this is the cholesterol, and this is the innermost is the triglyceride. So in the chylomicron, from lacteal, chylomicron may pass into the lymphatics and eventually reach the bloodstream via the thoracic duct. Chylomicron consists mainly of the triglycerides with small amount of cholesterol and cholesterol esters in the center, with phospholipid coats studded with lipoprotein. Okay, and the phospholipid outside with the apolipoprotein.